It's on engaging the patient or person. For example, a woman, oh, sorry, it's moving up. Let me try and get it. Let me try and get that question. Okay, how can I, sorry, does Victoria, would you like to ask this question? Says, engage, just a self-employed person, engage her with the right questions. How can I, just a self-employed question, engage her with the right questions? Well, basically, you want to know how long it's been, how old the lady is, how old her husband is, how long they've been trying, have they seen a doctor, have they had medical tests? You see, when a couple is looking for the fruit of the womb, there are a number of things that would be the case. It's either the challenge, and not to say fault, either the challenge is with the man, the challenge is with the woman, the challenge is with both, or the challenge is with none. Those questions need to be answered, and they would be answered. It's either one, the other, both, or none. And when you say none, it means that extensive tests have been done and been shown that there's nothing wrong with anybody. It's just not happening. And for me, I think that this one may actually be a free radical oxidative stress mediated. If you can't find anything, there must be something, you know. So that's a start to find out, to ask the right questions. If you ask all those questions, you would be able to know if the person is willing to talk about it. That is, because not everybody is always willing to talk about what can cause dizziness and weakness in a 67-year-old woman. What range of products can be recommended for her? And also hypertensive. Are you saying she's hypertensive? Anything can cause dizziness and weakness in a 67-year-old woman. You would have to ask a lot more questions. She's hypertensive. What medications is she on? Is she taking her medications? Has she eaten? Has she been fasting? You know, so there are different things that can cause. What is her blood pressure? In this case, if all these don't show what, she might have to see her doctor and be assessed. We want to know, is her pulse, has she lost fluids? Has she, you know, there's so many things that could cause that. Yeah, but I mean, she would start, you see, the basic, when a person has a complaint, okay, they've seen the doctor and all that, I would say start with Reader Herbal Bitters. You will not go wrong starting with Reader Herbal Bitters. And then in the 2 weeks after they have started, if anything else comes up, we would know what variant to add, if any. I think, does that answer your question, Mrs. Abiose? You just facilitated a basic certificate program. Yeah, it's part one of a basic certificate program. There's still so much, you know, yes. Thank you. Okay. Okay, it's 3:01. We've overshot the, funny, I didn't even think I would spend 30 minutes on this. CM, would you like to have give some comments, or, you know, are we done?